Hello viewers. How are you? This is Rishi. Coronavirus is still a headache for many countries in the world. Doctors, nurses, and health professionals all over the world are working hard to save the lives of the sick. In the meantime, several prominent countries are working day and night to find drugs to fight this virus. We talked in a previous video about COVID-19, a few basic details. In this video we'll talk more about it. Especially I hope to talk about the medicinal policies currently being used. COVID-19 is a new coronavirus infectious disease found after the outbreak in Wuhan, China in December 2019. Since its initial outbreak, the coronavirus known as SARS-CoV-2 has spread to many countries around the world. It causes millions of infections globally and causes hundreds of thousands of deaths. The most affected country is the United States. There is still no vaccine against the coronavirus novel. Researchers are working on a vaccine specifically for this virus, as well as potential treatments for COVID-19. Older adults and those with underlying health conditions are more likely to develop the disease. Many people experience the development of symptoms of COVID-19. Shortness of breath, dry cough, fever, fatigue. Less common symptoms include sore throat, headache, chills, with or without repeated shaking, loss of taste or smell, muscle aches and pains. If we talk about current treatments, there is currently no vaccine against the development of COVID-19. Because COVID-19 is a viral infection, not bacteria, antibiotics are ineffective. If your symptoms worsen, your doctor or hospital may offer supportive care. This treatment may include, in the most severe cases, extra oxygen, fluids to reduce the risk of dehydration, medication to reduce a fever. Those who are unable to breathe on their own due to COVID-19 may need a respirator. The CDC recommends that all public places where it is difficult to maintain a distance of 6 feet from others should wear cloth masks. This helps slow the spread of the virus from people who do not have symptoms or do not know they have contracted the virus. Cloth masks should be worn while maintaining physical distance. A reliable source for homemade makeup can be found here. You should know, it is very important for health workers to reserve surgical masks and N95 respirators. Vaccines and treatment options for COVID-19 are being investigated worldwide. There is some evidence that certain actions may be effective in preventing disease or treating the symptoms of COVID-19. However, researchers must perform randomized controlled trials in humans before receiving potential vaccines and other treatments. Which of these is the most effective treatment? Here are some of the treatment options currently under investigation to protect against SARS-CoV-2 and COVID-19 symptoms. Favilavir. COVID-19 has been approved by China for the use of the antiviral drug Favilavir. The drug was originally developed to treat nose and throat inflammation. The results of the study have not yet been released, but in a clinical trial of 70 people, the drug has been shown to be effective in treating COVID-19 symptoms. APN-01. A clinical trial to test the potential of a drug called APN-01 to combat the coronavirus novel is set to begin soon in China. In the early 2000s, scientists who first developed APN-01 discovered that a protein called ACE2 was involved in SARS infections. This protein also helps protect against lung injury due to respiratory problems. Recent research shows that the 2019 coronavirus virus, such as SARS, also uses the ACE2 protein to infect people's cells. A randomized, double-handed trial will investigate the effect of action shedding on 24 patients per week. Half of the participants in the trial will receive the APN-01 drug, and the other half will receive a placebo. If results are encouraging, large clinical trials will be conducted. Remdesivir. Remdesivir is an experimental broad-spectrum antivirus drug. Researchers have found the remedy to be effective in fighting coronavirus novelty in isolated cells. The drug is not yet approved in humans, but 2 clinical trials have been carried out in China. One clinical trial was recently approved by the United States FDA. Lopinavir and ritonavir. Lopinavir and ritonavir are marketed as Caltra and designed to treat the Hai virus. In South Korea, A 54-year-old man was given a combination of these two drugs and had a significant reduction trusted source in his levels of the coronavirus. According to the World Health Organization, there could be benefits to using Caltra in combination with other drugs. Chloroquine. Chloroquine is a drug used to fight malaria and autoimmune diseases. It has been used as a reliable source for over 70 years and is considered safe. The trusted source of at least 10 clinical trials is exploring how chloroquine can be used as an alternative to fighting coronavirus. If you have any COVID-19 symptoms, what do you want to do? Some people get the virus and do not develop symptoms. When symptoms occur, they are usually mild and come slowly. COVID-19 appears to cause more severe symptoms in older adults and in people with health conditions such as chronic heart or lung conditions. If you think you have COVID-19 symptoms, follow this guide. Measure how sick you are. Ask yourself how likely you are to get involved with the coronavirus. If you live in an epidemic, or if you have recently moved abroad, you may be at increased risk of exposure. Call your doctor. If you have mild symptoms, contact your doctor. To minimize the transmission of the virus, many clinics encourage people to chat or use live chats instead of visiting the clinic. Your doctor will evaluate your symptoms and work with local health authorities and the Centers for Disease Control and Prevention to determine if you should be examined. Stay at home. If you have a COVID-19 or other type of viral infection, stay home and rest. Stay away from other people and avoid sharing glasses, utensils, keyboards and phones. About 80% of trusted individuals recover from COVID-19 without needing hospitalization or special treatment. If you are young and healthy with mild symptoms, your doctor will advise you to isolate yourself at home and limit contact with others in your home. You will be advised to relax, stay hydrated and monitor your symptoms closely. If you are an older adult, have an underlying health condition or immune system, be sure to consult your doctor immediately if you notice any symptoms. Your doctor will advise you on the best course of action. If your symptoms worsen with home care, it is important to seek prompt medical attention. Call your local hospital, clinic or emergency care to let them know you are coming, and wear a mask once you leave home. Call 911 for immediate medical attention. It is important that we know how to prevent the spread of the coronavirus. The coronavirus novel is basically transmitted from person to person. In this case, the best way to prevent infection is to prevent people from being exposed to the virus. In addition, according to the CDC's trusted source, you can follow these steps to reduce your infection risk. Wash your hands thoroughly with soap and water for at least 20 seconds. Avoid touching your face unless you have recently washed your hands. Stay away from coughs and sneezes. The CDC recommends standing at least 6 feet from anyone who is sick. Avoid crowded areas as much as possible. Older adults are at higher risk of infection and may need to take extra steps to avoid contact with the virus. In this case, there is no vaccine to protect you from the coronavirus novel, also known as SARS-CoV-2. There also are no special medications approved to treat the symptoms of COVID-19. However, researchers around the world are working hard to develop potential vaccines and treatments. There's emerging evidence that some medications may have the potential to treat the symptoms of COVID-19. More large-scale testing is needed to determine if these treatments are safe. Clinical trials for these drugs could take several months. Okay. It's very important to be aware of this. Well aware, let's get rid of this epidemic soon. You have to be aware and educate someone else. Thank you for watching.